Hello dear students, I am Dr. Garima Suryavanshi, MD Physiology, your guru for the subject for physiology. I am a part of this LNCT Guru. We will be covering 100 questions in the subject of physiology. Hope that will help you in your exams. Thank you. Let's start with question number 1. The Weber-Fechner's law relates to the magnitude of sensation to option A, strength of muscle contraction, option B, intensity of stimulus, option C, amplitude of action potential, and option D, duration of stimulus. The answer for this question is option B, that is intensity of the stimulus. This is a very important law in physiology, that is the Weber-Fechner's law, which states that the magnitude of sensation which you are feeling is proportional to the log of intensity of the stimulus. Another important law in physiology is your Bell-Megendie law. Now this Bell-Megendie law, it states that your dorsal roots of your spinal cord, they are always sensory. So these two laws you should be very thorough in physiology. Now we move on to the next question, that is question number 2. Auditory information is relayed through which thalamic nucleus? The options for this question are option A, dorsomedial nucleus, option B, lateral geniculate nucleus, option C, medial geniculate nucleus, and option D, that is ventral posterolateral nucleus. The answer for this is your medial geniculate nucleus. Okay. Why medial geniculate nucleus? Because जो भी अपने auditory impulses होते हैं, like from ear to the auditory cortex which is present in your cerebrum, तो वो कहाँ से जाते हैं? They are travelled from the brainstem to the auditory cortex via medial geniculate nucleus. अगर हम lateral geniculate nucleus की बात करेंगे तो it is mainly concerned with your visual information, that is the information from your vision or from your eyes. The next question, diagnose the given condition from the picture which is shown below. The options for this question are A, Cushing syndrome, B, it is Addison's disease, C, it is hyperthyroidism, and D, it is pregnancy. The answer for this is your A, that is Cushing syndrome. In the picture, you can very well see these are the red colored or the purple colored stria. Now, these are characteristically seen in the Cushing syndrome. Now, what is Cushing syndrome? It is the disease or the disorder which mainly occurs because of excess of cortisol. Now, other characteristic features for this Cushing syndrome are moon face. What is moon face? There is a swelling over the face and it appears like a round and swollen. That is a moon face. Okay. Another one is a centripetal obesity and overweight. Because of cortisol excess होने के वजह से सारे metabolism बढ़ जाएगा, बढ़ने के वजह से like metabolism of carbohydrate, proteins and fat metabolism, it mainly increases, जिसके वजह से you have the fat deposition at the centripetal zone, मतलब abdomen में. That's why we call it as a centripetal obesity. Then the third is amenorrhea. Fourth is reddish purplish striae, which we have already seen in the image, and finally the buffalo hump, that is at the neck there will be again deposition of the fat which is contributing to the typical presentation like a buffalo. जैसे buffalo के ऊपर hump होता है ना, वैसा दिखता है वो. Then we move on to the next question, that is question number 4. The type of hypoxia present in high altitude is, the options for this, A is A for anemic hypoxia, B hypoxic hypoxia, C stagnant hypoxia, and D histotoxic hypoxia. The answer for this is option B, that is hypoxic hypoxia. Why this is the hypoxic hypoxia? What is hypoxia? Hypoxia means it is decreased oxygen concentration in your blood. अब इसके बहुत सारे reasons हो सकते हैं. मोस्ट इम्पॉर्टेंटली अगर आप जो एयर इंस्पायर कर रहे हो उसी में ऑक्सीजन कम हो गया तो नेचुरली आपके ब्लड में ऑक्सीजन लेवल्स कम हो जाएंगे. सो हाइपोक्सिया इज व्हाट व्हेन योर आर्टेरियल PO2 इज रिड्यूस्ड. अब हाई एल्टीट्यूड में आप जैसे जैसे जाते हो वहाँ पे क्या होता है, इंस्पायर्ड एयर में ऑक्सीजन का कॉन्सेंट्रेशन और परसेंटेज और सैचुरेशन कम होता जाता है. जब ऑक्सीजन में ऑक्सीजन मतलब जब एयर में ही ऑक्सीजन नहीं है तो हाउ कैन यू एक्सपेक्ट कि जो आप एयर ले रहे हो तो आपके ब्लड में नॉर्मल ऑक्सीजन लेवल्स होगा. तो इसीलिए देयर इज O2 is lowered in your inspired air at high altitude, and the type of hypoxia which is seen at high altitude is your hypoxic hypoxia. The next question is question number 5. According to Einthoven's law, the options for this question is option A, 1 plus 3 is equal to 2, B, 1 plus 2 is equal to 3, C, 1 plus 3 is equal to AVL, and option D, it is 1 equal to 2 equal to 3. So this is what are these 1, 2, 3? These are nothing but your leads. Okay. The answer for this question is option A, that is lead 1 plus lead 3 is equal to lead 2. Okay. Now what is the Einthoven's law? Einthoven's law, it states that अगर आपको दो लीड का पोटेंशियल पता है, that is if you know the electric potential of the out of the 3 bipolar leads at any given instant of time, तीसरा का आप इलेक्ट्रिक पोटेंशियल आराम से निकाल सकते हो. So this can be mathematically written as lead 1 plus lead 3 is equal to lead 2. Okay, so this is your Einthoven's law. Now we move on to the next question, that is question number 6. Crypts of lubricant form. The options for this question are option A, intestinal secretion, B, gastric secretion, C, hepatic secretion, and D, pancreatic secretion. The answer for this is option A, that is intestinal secretion. Okay. Now what are these crypts of lubricant? Now the crypts of lubricant are nothing but they are your intestinal glands. मतलब intestinal glands का अगर कोई दूसरा नाम है तो वो क्या है? It is your crypts of lubricant. Obviously intestinal glands है तो वो intestinal secretions ही बनाएंगे. So the answer for this question is your intestinal secretion. Now we move on to the next question, that is question number 7. The urge for micturition is felt when bladder is filled with. The options for this question are A, 150 to 200 cc of urine, B, 300 to 400 cc of urine, C, 500 to 700 cc of urine, and D, 800 to 900 cc of urine. So whenever we talk about the urge for micturition, okay, the answer for this is your 150 to 200 cc of urine, that is your option A. Now this is very important because question में क्या वर्डिंग्स है उसके हिसाब से आपको वॉल्यूम चूज करना है. यहाँ पे क्वेश्चन में क्या था? अर्ज मतलब द फर्स्ट सेंसेशन जब आपको लगता है कि दैट यू शुड गो एंड मिक्चुरेट. दैट सेंसेशन वो कब होता है? इट इज दैट इज सेंसेशन टू पास यूरिन. इट मेनली अकर्स एट 150 टू 250 ml. ब्लैडर फिलिंग मतलब लाइक अभी ब्लैडर फुल हो गया. ओके, दैट सेंसेशन इट इज अराउंड 150 ml. ठीक है, बट ये जो सेंसेशन है ब्लैडर फुल हो रहा है एंड यू आर नॉट एबल टू पास द यूरिन एंड यू आर बिकमिंग अनकंफर्टेबल. दिस सेंसेशन ऑफ अनकंफर्टेबल जो होता है कि वी आर नहीं आना, आई शुड गो एंड पास द यूरिन, ये कब होता है? इट इज एट द 400 ml. बट फिर भी इफ यू कैन नॉट पास द यूरिन देन इट इज एट द 700 ml जब it becomes very painful and it is really not controllable. Okay, so these are the different values of urine in the bladder. Accordingly आपको answer choose करना है. ठीक है. Now we move on to the next question, that is question number 8, that is effectiveness of the control system is assessed by. The options for these questions are A, gain, B, loss, C, recovery, and D is improvement of the function. The answer for this question, it is the gain. Gain. जब भी हमको कोई भी सिस्टम का इफेक्टिवनेस देखना होता है, अपने बॉडी में वी हैव मैक्सिमम नंबर ऑफ कंट्रोल सिस्टम. तो जो भी हमको कंट्रोल सिस्टम चल रहे हैं अपने बॉडी में, जो फिजियोलॉजिकल कंट्रोल सिस्टम्स हैं, उसकी इफेक्टिवनेस कौन जज करता है? गेन जज करता है. गेन इट इज गिवन बाय द फॉर्मूला करेक्शन अपॉन एरर. एंड यू शुड ऑलवेज रिमेंबर जो आपका थर्मो रेगुलेशन है उसका गेन मैक्सिमम है. सो द मैक्सिमम गेन इट इज सीन फॉर योर temperature controlling system of your body which is sensed by your skin. आई बात समझ में? So this is the answer. Now we move on to the next question, that is question number 9. Lifespan of a leukocyte is. The options for this is option A, 4 to 6 minutes, option B, 4 to 6 hours, option C, 4 to 6 days, and option D, 4 to 6 months. The answer for this question is option B, that is 4 to 6 hours. ओके, मैक्सिमम स्टूडेंट्स क्या सोचते हैं यार, लाइफ स्पैन ऑफ आरबीसी विल कम. तो लाइफ स्पैन ऑफ आरबीसी आई थिंक मैक्सिमम ऑफ द स्टूडेंट्स नो दैट इज इट इज 120 डेज. ल्यूकोसाइट्स का या डब्ल्यूबीसीज का बहुत कम बुक्स में दिया है, it is not generally referred also. So here is a trick, आपको it is 4 to 6 hours. For the platelets also you should know what is the lifespan for the platelets. It is 8 to 12 days in circulation. Now we move on to the next question, that is question number 10. Potassium channels, they are blocked by option A nifedipine, option B saxitoxin, option C tetraethyl ammonium, and option D is tetrodotoxin. The answer for this question is option C, that is tetraethyl ammonium. I think you are very well aware of your sodium channels and potassium channels. Sodium channels के activation gates होते हैं, inactivation gates होते हैं. Potassium channels में you don't have these kinds of gate. So जो potassium channels हैं, they are specifically blocked by this chemical, that is tetraethyl ammonium, while the sodium channels, they are blocked by your tetrodotoxin.